A 34-year-old man attempting to optimize his health through ketosis took a standard dose of medicine, triggering a catastrophic failure of his cellular metabolism. He presented to urgent care with a ghostly blue complexion and a heart rate of 120 beats per minute. LV is an office manager presenting to the emergency department with acute chest tightness and gasping for air. On examination, his lips and fingernails show a striking shade of slate blue, a condition known as cyanosis. Cyanosis occurs when deoxygenated hemoglobin levels exceed 5 grams per deciliter, causing the blood to lose its vibrant crimson and take on a muddy, violet hue that reflects through the skin. Despite the medical team placing a high-flow oxygen mask on his face, the pulse oximeter remains stubbornly stuck at 85%. While his lungs sound perfectly clear, his arterial blood gas reveals a normal partial pressure of oxygen, creating a baffling diagnostic paradox. Anatomy of a Mistake examines how LV arrived at this physiological stalemate, where the oxygen in his lungs simply could not reach his cells. As the respiratory therapist draws a sample for the arterial blood gas, the room falls silent. Instead of the bright scarlet red indicative of healthy oxygenated blood, the syringe fills with a thick, dark liquid the color of melted chocolate. This deep brown hue is pathognomonic for methemoglobinemia. This slate blue hue is a pathognomonic sign, a specific clinical finding that points directly to a single diagnosis without the need for further initial testing. In LV's case, the discoloration did not improve with supplemental oxygen, distinguishing it from simple lung or heart failure. This condition occurs when the iron within hemoglobin is oxidized from its functional ferrous state into an unusable ferric state. In this altered form, the iron acts like a rusted lock on a delivery truck, refusing to release oxygen to the starving tissues. To visualize the scale of this failure, imagine a fleet of 10,000 delivery trucks parked at a warehouse. In LV's body, 5,000 of those trucks have had their doors welded shut, while the other 5,000 are gripped so tightly by their cargo that they refuse to let go at the delivery site. Searching for a trigger, the physician discovers LV was recently prescribed nitrofurantoin, 100 milligrams twice daily, for a routine urinary tract infection. While usually safe, this antibiotic is a potent oxidizing agent. If the body's internal repair crews are overwhelmed, the drug's metabolites begin a microscopic assault, stripping electrons from red blood cells and converting life-giving hemoglobin into a useless brown pigment. To understand why a standard dose caused such a collapse, the team had to look into LV's recent metabolic choices. He had no family history of enzyme deficiencies, such as G6PD deficiency, which usually protects the red blood cell from such oxidative stress. This suggested that his current state was not a genetic destiny, but a self-inflicted biochemical trap. 3 weeks prior, LV started a strict ketogenic diet to lose weight rapidly. By nearly eliminating carbohydrates, he inadvertently throttled his pentose phosphate pathway. This metabolic route is the primary source of NADPH, a crucial cofactor. The patient's cellular energy production relies on glycolysis, the primary metabolic pathway that breaks down glucose into pyruvate to generate adenosine triphosphate or ATP. Without glucose breakdown fueling the pathway, NADPH production plummeted. This is critical because NADPH is essential for recycling glutathione, the cell's primary antioxidant. Glutathione is the body's primary antioxidant, a tripeptide that neutralizes reactive oxygen species before they can damage the red blood cell's fragile membrane. In a healthy state, this molecular shield maintains iron in its ferrous form, allowing hemoglobin to carry oxygen effectively. However, LV's strict ketogenic diet had already depleted his hepatic glutathione stores by nearly 40%. Without it, his red blood cells were defenseless. The mild acidosis from his nutritional ketosis further accelerated the oxidation of heme, making his hemoglobin even more vulnerable to the nitrofurantoin. While LV was burning fat, he was also burning through his only defense against the drug. He had essentially removed the fire extinguishers from a room filled with dry tinder, then invited an oxidizing spark inside. By hour 4, LV's condition reaches a critical tipping point as his tissues begin to starve in a state of histotoxic hypoxia. This occurs when oxygen is present in the blood but cannot be utilized by the cells. His brain, the most oxygen-sensitive organ, begins to fail, leading to global hypoxic ischemic encephalopathy. LV is experiencing encephalopathy, a state of profound mental confusion and lethargy caused by the brain's inability to utilize oxygen despite it being circulating in his bloodstream. As he slips into a coma, his heart muscle begins to scream for air. The EKG monitor shows ST segment changes, a clear sign of ischemia. This occurs when oxygen demand in the heart muscle outpaces the actual supply, a critical warning that the cardiac tissue is beginning to suffocate despite the patient breathing at maximum capacity. This signals that his cardiac tissue is literally suffocating despite the high-flow oxygen being pumped into his lungs. Meanwhile, his kidneys develop acute tubular necrosis as the lack of oxygen kills the delicate filtration cells. The medical team realizes they are fighting the pulse-ox gap. Because methemoglobin absorbs light at both 660 and 940 nanometers, the bedside monitor is effectively blinded, reporting a false 85% while his actual life-sustaining oxygen delivery has plummeted. With methemoglobin levels climbing past 50%, LV is now facing imminent death from profound lactic acidosis and seizures. To put this in perspective, normal methemoglobin levels are less than 1%. LV has 50 times the normal limit of this cellular poison circulating through his heart. If his level reaches 70%, his heart will stop entirely, as the blood becomes too thick and dysfunctional to support the basic electrical rhythm of life. The medical team must act before the damage to his cerebral cortex becomes permanent. To save LV's life, they must perform a chemical reversal. They administer methylene blue at a dose of 1 to 2 milligrams per kilogram of body weight. Methylene blue is an intense synthetic dye that functions as a molecular electron donor. Once in the bloodstream, it utilizes an alternative pathway involving the enzyme methemoglobin reductase. It bypasses the broken metabolic pathways caused by his diet to provide the necessary electrons to reduce the ferric iron back into its functional ferrous state. It is a race against time, as the nitrofurantoin is still circulating, continuing to oxidize any hemoglobin the methylene blue manages to repair. Within minutes, a dramatic transformation occurs. LV's skin shifts from that deathly blue back to a healthy, vibrant pink as his hemoglobin regains the ability to carry oxygen. His pulse oximetry finally climbs from the deceptive 85% to a true 99%. As the oxygen begins to flood back into his tissues, his heart rate stabilizes and his blood pressure begins to rise. The chocolate-colored blood in his IV lines begins to clear, turning back to the bright crimson of a healthy adult. Over the next 24 hours, his kidney function begins to recover, and he slowly regains consciousness, confused but alive. LV suffered from a ketopotentiated reaction, where a common antibiotic became a poison due to extreme dietary restriction. This case serves as a vital reminder that our nutritional choices directly dictate our biochemical resilience. The very pathways we suppress to achieve weight loss are often the same ones that protect us from environmental and pharmaceutical stressors. Thank you for watching this episode of Anatomy of a Mistake. If this clinical breakdown of LV's metabolic crisis was helpful, please like the video, comment with your thoughts or questions, and subscribe to Anatomy of a Mistake for more cases. This is a composite teaching case for curiosity and education, not a transcript from a real chart, and not personal medical advice. See a licensed clinician about your own symptoms or care.